Hey there. I'm going live in the group, so I'm doing this a little bit differently. Usually I go through my Zoom account, and I just wanted to pop on. I'm in full preparing for surgery mode now. I got my surgery on Wednesday. I have a troubling cyst, and it's got to go. But there's a couple things I really wanted to make sure that I did before I go in for surgery because I'm just one of those types of people that I know it'll be bugging me that I didn't actually do this before. So, this is your comprehensive symptoms list, and I talked about this in the class that I just did called Thriving in Peri and Postmenopause. It's available in the chat called CPMS Comprehensive Symptoms List. A few people have been like, well, I'm not in peri, so it doesn't apply to me. That's not true. It does. The symptoms are the same, except for bleeding. No bleeding allowed post-menopause. If you have any bleeding, any spotting, anything at all, you have to go get that checked out right away. Whereas in perimenopause, bleeding is considered part of that journey, that you're going to have unexpected periods. So what you do is you go through and you score yourself with your symptoms. So the first one is irregular heartbeat, strong, fast, or skipping beats. I have had this one quite a lot in the last year, probably, since my mother-in-law passed away in April. It's a stress response for me. I have an adaptogen that helps me with that, but I have to go off everything for the surgery, so I'm having more symptoms. So I would say often for that one for me at this point. When I'm on my adaptogen, it's sometimes, right? And then, so the one about bleeding, which is the only one that's different, let's see if I can find it. The only one that's different between peri and post is the bleeding. Post-menopause, no bleeding, but we have irregular bleeding, heavy periods, clotting, severe cramping, spotting, no period, late period, pink, brown, or red blood. It's all considered part of it. Or sudden periods with no warning, or cramping, bloating, acne with no flow, the phantom period. There's a couple things that are missing on here, breast tenderness, and now of course I can't remember what the other one was because I can't take my lion's mane because I'm getting a surgery on Wednesday. So when you go and you print this out, I want you to get it emailed to yourself through the list. You can get it from the chat. There's a chat in the group called Comprehensive Symptoms List. You click that link, it takes you to another page, you put in your email, it gets emailed to you. It signs you up for my newsletter, which is just me. It's just me sending you a newsletter, and I send one out maybe once a month. I was going to send one before my surgery, but I might not do that now because I'm kind of running out of time. But I might tomorrow if I have time. And I don't do it more than that. Like, so I'm not one of those coaches that's going to be like, you give me your email and then I'm inundating you every day with an email. That's not me. I'm not trying to annoy people or convince you of anything. I'm just here for you if you need me. You print it out. Print it out. It's not just a list so you can look at it. So you look at all the symptoms and then you grade yourself. Always, never, and there's a little spot for notes so you can write in your notes. And then you take that to the doctor, take that to the naturopath, take that to the nurse practitioner, whoever you're working with, and then they can look and they can see for themselves because they may have already dismissed you. You might have said, I'm having heart palpitations. And they have said, oh, well, whatever. But then they look on this list and it says, I'm always having heart palpitations. And the note says, I have heart palpitations every day. Well, now they're going to take you a lot more seriously. So that's one way you can use it. And the other way you can use it is as a guide to how your supplements are working or changes in your diet, changes in your lifestyle, working with a coach. So when I sign someone up, I always say print it out and fill it out. And then you're going to fill it out again every 3 weeks. And what will happen is your check marks should go from the right-hand side to the left-hand side because your symptoms are moving from always to never. So that's basically why I keep talking about it's on the list. This is the list that I'm talking about. It's on this list, the list that I put together, because people really want to know what's normal, and we try not to define things as normal because, you know, that kind of implies just put up and shut up. And that's not what we mean. It's just, is it part of the perimenopause journey or not? And yes, it is for a lot of people. So I'm just going to put in the chat there the name of the chat that you can find the link for the comprehensive symptoms list. And people do talk about other stuff sometimes, or they ask specific questions. And I try to always just reshare the list so that it's easy to find. But if you can't find it right away, just scroll up and look for the link. And okay, so that's what I wanted to make sure that you can find that. Oh my goodness, it changed chat to Fairmont Chateau. Like, oh my God. Facebook has been pretty annoying lately. I had someone else complaining about that too. Like, stuff is getting flagged as spam that's not spam. And one of my pictures got flagged as child porn when it's not anywhere close to child porn. So there's a bot, and the AI is watching, and we have to be very careful about what we're sharing. Okay, and then if you do have any questions, you can just send me a message directly, or you can ask in the main group, or you can ask in the chat. But I'm gonna I try to keep people like on track. If it's a chat about like, I had one chat that was about lichen sclerosis, and I was trying to just keep like, let's just talk about that topic, right? That's what the chat is called. We don't have a general chat. I've made my sister-in-law Yvette admin of the group. I've also made the page that I started, Canadian Perimeno, an admin of the group, because I always feel like, you know, I might die in surgery, and I don't want the group to get shut down if I'm gone, because so far I've been doing everything. So I'm just posting the Canadian Perimeno page so you guys can like that too. And then you know, of course, there's one other thing that I wanted to share, and I cannot remember what it is whatsoever at this moment, but I'm going to call that good enough. And I'm trying to endeavor to keep everything short so that I'm not rattling on, because I do have a tendency to chat. If you have any questions, you can just let me know. And we will talk again soon. My surgery is Wednesday morning, and I will probably, well, we all kind of agreed it's better if I'm not online trying to talk to people when I'm on painkillers. Thank you, Norma. I'm feeling like it's the best choice for me. I've had ovary pain for, you know, I'm thinking several years now that that's what it was. We didn't really know, or I didn't know what it was, but yeah, it's got to go. So that's what's happening. And I will see you all in the group real soon.